gonna do as best as possible to create the environment where you can do lab cultures, or any type of science process in or outside the lab. So that's what aseptic technique is. You guys are familiar with it when we've done those culture plates, you know, and the first thing that we tried to do was everybody washing their hands, right? And then coming back, and then you get your gloves and your lab coat and your goggles. Would you consider those to be essential aseptic procedures to make sure that your microbes and even your health is protected? I know, you don't have to like write it all completely, but just things that, like, if you don't know it or you're uncomfortable with, just jot down notes. Yeah. All right, so today's learning objective is going to be identify how bacteria may spread by applying their knowledge of aseptic technique and then practicing this skill in the lab. Now, that second part,
Yeah.
I'm sorry, we're not gonna be able to do it only because this is not a science lab classroom. So, we'll try our best to get through this, second part of this lesson. Now, our key points, of course, aseptic technique refers to the set of practices used to prevent contamination. Can you guys give me an example of a place here on school that needs to be maintained as clean and as sterile as possible?
The cafeteria.
Cafeteria, very important. Yes, sir.
Water fountain?
Water fountain, that's enough.
Bathrooms?
Bathrooms, pretty much everywhere, right? Especially when, a couple of weeks ago, the people were getting sick, right? Like COVID-like symptoms and everything. How do you think that pathogen was getting spread? Right, well, what process could
The
have?
water fountain.
Sneezing?
Yes.
Sneezing,
Washing
coughing?
your hands.
If you didn't wash your hands and you're grabbing the handles, grabbing surfaces, lending your friends your laptop, anything, right? Any surface is a potential harbinger of disease for these microbes. So it's, like I said, very important, especially those of you who are going into the medical field, to learn this and like ingrain it into yourself, because it's gonna be extremely important to your career and your job and your family's health. When I was in hospital pharmacy, I also had to go to the baby wing for the NICU, the premature babies. Some of them had like life-threatening illnesses that they had caught from their mother, just randomly, right? And at that time, I had, my first child was newborn también. So there were some rooms where I had to go in. You go into the first room, and then you have to gown up.
College prep teachers, please submit OETP. College prep teachers, please submit OETP.
Hold that. Alright, sorry about that, let's get back to this. So anyway, so those patients had some sort of infection or problem, where that I had to literally change my clothes every time I walked in to their room, to their hospital room.
With gowns?
Yeah, gowns, masks,
There.
everything. Like, I had to be gowned up from head to toe, because the baby had an infection that if I had transferred it to my child, could have killed him. So just keep that in mind. Now, the cafeteria thing, yeah, that is extremely important, because imagine if they weren't doing their job and then you guys eat the lunch and half the school doesn't come into school for a few days because they have stomach poisoning, food poisoning. Now, the equipment and materials that are used in aseptic technique think of the biosafety cabinets. We don't have them here, but in the closets across the hall with Mr. Ake and up there with Mr. Wakaba, inside the closet, we have certain cabinets. The one for flammable and another one for biohazard. So these kind of, this equipment and the materials, like the alcohol, for example, the 91% alcohol, that is highly flammable. So we have to keep them safe and away from people that don't know how to use it, because it's very easy. One of the things I noticed in one of the other labs that we did, there was a beaker full of a liquid. It was a clear liquid, but it hadn't been properly labeled. So just imagine, if you're using something that you don't know what it is, would you be at risk of, I guess, not only harming yourself, but like ruining the experiment? So just imagine, the food that you guys buy, the drinks, everything, if it wasn't labeled, you're running the risk of ingesting something that's gonna hurt you, right? Now, the criteria for success is that you're gonna be able to describe aseptic technique and its relevance or its importance in preventing contamination of cultures, regions, and lab environments. You're gonna demonstrate proper hand washing, or at least try to. Yeah, when we get to that point that we can easily do these things, then it'll become more familiar. But the gloves, the lab coats, the goggles, we have those, so we need to know how to use them properly in our class. And like always, you maintain a clean and organized workspace. That's why the school provides us with these wipes. They provide us with spray bottles to clean our surfaces so that we can prevent pathogens from spreading. Okay, now, the aseptic culture, so those plates that were growing back there, that have the lid on them, remember I told you guys that we're gonna work to isolate one specific type of bacteria, right? That's our goal. Those plates have maybe 3 or 4 different bacteria growing at one time, but we wanna isolate one and streak a brand new plate and grow it. That's aseptic technique is crucial for that. All right, so the question of where should aseptic techniques occur? You guys pretty much answered it already, cafeteria, classroom, but what about at home?
Well, at home, like, you wash your hands, and wipe after, like, the stuff you drop.
True, yeah.
And you,
Now, those of you who help your parents like clean up, what rooms are like very important to keep clean?
kitchen, the restroom.
Kitchen,
Restroom.
dining table?
Yeah.
Yeah.
And dishes you use to make.
Yeah, yeah, imagine if you didn't wash your
Yeah.
food. I've seen some of those, on TikTok, where they're like these Japanese people that they stream their lives and their apartments is like, almost like a closet, real small. It's like, just filthy, and they make money off making videos about cooking with filthy dishware. Yeah, I mean, it's crazy. If you need to go quickly. When are you gonna? Alright, so anyways, where should aseptic techniques occur? Like I said, anywhere you're at that has potential harmful bacteria or viruses, any pathogen that can harm your health or other people's health. And why? It's pretty self-explanatory. Why do we need a sterile environment? In the case of the medical field, is to make sure that the patients do not catch a secondary infection that can hurt them or actually kill them. In the lab setting, why do we need a sterile environment? Like, what is one of the main reasons why we need a sterile environment when we're working with bacteria?
So like you.
Like, think of like right now you're working with the cultures and you identify one specific bacteria that you want to isolate on a new plate. What is the risk that you're